Hello and welcome back to Online Derm Clinic. I'm Dr. Chris Schock. In this tutorial, we're going to talk about a very common skin disease known as atopic dermatitis or eczema. This will be an overview of eczema, and a later tutorial will be about treatment options. So let's get started talking about atopic dermatitis. Well, atopic dermatitis is often known as eczema, and eczema is allergic, sensitive skin. It usually starts in infancy, around the age of 3 months. That's when infants can develop a coordinated scratch. It becomes red and scaly. Their skin tends to be dry. It's often known as the itch that rashes because the skin is very itchy, and once you start to scratch the skin, the eczema patches form. So that's when the skin becomes red and scaly. We like to think of it as a combination of two things. One is a poorly functioning barrier. So infants and people with eczema, atopic dermatitis, tend to have more dry skin. So there's a lack of those barrier oils to protect them from all the irritants and allergens in the environment. That combined with an allergic system leads to atopic dermatitis. So along with that allergic system, people with atopic dermatitis have an increased risk of having asthma, allergic rhinitis, food allergies, or hives. Here you see an example of a child with atopic dermatitis. It's on the extensor or the outside aspects of the arms. It's red, scaly, and dry. So how do you make the diagnosis? Well, it's made clinically by pediatricians or dermatologists or primary care physicians. In infancy, it looks a little different. It's often on the cheeks, and it often spares the perioral skin in infants. That's sometimes known as the headlight sign because it's bright red on the cheeks but clear around the mouth. The diaper area is usually spared, and the extensor surfaces, as we saw in the previous slide, are often involved. In childhood, atopic dermatitis changes to involve the skin folds of the arms, the flexural aspects of the arms, the skin folds of the legs. Also, the perioral skin tends to become more involved in childhood. The skin also can become thickened, or what we call lichenified, from chronic scratching. In adults, thankfully, we often outgrow atopic dermatitis in childhood around the age of 10 to 13 years of age. It often improves, and then adults, we've usually outgrown it. However, adults with a history of atopic dermatitis are at increased risk of hand and foot dermatitis, and they may also develop eyelid dermatitis. Here's an infant with atopic dermatitis. You can see the sparing around the mouth and some diffuse erythematous or red scaling patches of skin. Here's an example of atopic dermatitis on the hands. And here the flexural involvement that I referred to. So what can happen? What are some of the complications of AD or atopic dermatitis? Well, a herpes outbreak in a child with atopic dermatitis can lead to what's called eczema herpeticum. So all of the breaks in the skin allow for a portal of entry for the herpes virus, and it can spread over much of the body. And it can actually cause serious infection and lead to organ damage and inflammation. Most children with eczema carry staphylococcus. In fact, about 93% of atopics carry the staph bacteria, and anytime we're seeing a flare of the disease, that can indicate an overgrowth of the staph bacteria. And if we see weeping of the skin, scabs or pustules or honey-colored crust, that often requires oral antibiotics. Molluscum contagiosum is often worse in our atopics. So let's take a look. Here's an example of eczema herpeticum. A baby with atopic dermatitis developed blisters around the mouth, the cold sore virus, and then that rapidly spread over much of the body. And here you can see some of the ulcers from the broken blisters, or what we call vesicles. And here is another picture of that infant's foot with the chickenpox-like blisters on the feet. Here is an example of impetigo with this yellow honey-colored crust in a patient with severe atopic dermatitis. And here's an example of molluscum contagiosum having a more severe outbreak in a child with atopic dermatitis. Hope you found this overview of eczema helpful. Thank you for joining us.